I graduated as a doctor in 1955, and I was posted to the General Hospital Kuala Lumpur to do my housemanship. And I had the privilege of working in the children's ward. It has got 36 beds, 18 on each side. But the most sad thing about this is that on one side, the 18 beds were full of children suffering from diphtheria and who had a tracheotomy done on them to keep them alive. Because they came usually in the evenings and late evenings and late night by their parents, especially the mothers. The children were blue in their faces because they couldn't breathe anymore because of the membrane, diphtheria membrane in their throat. And we in the emergency ward had to do something to release for the child to breathe again. And this is what we call a tracheotomy, which is making a hole in the trachea of the child so that the child will breathe from this little hole. And you can see the child's face turning from blue to pink, which indicates that the child is okay with the breathing again. Whole of the 18 beds in the Ward 18, where I was in charge, were full of these children with tracheotomies. On the left side of the ward are 18 children suffering from what we call tuberculosis, meningitis, which affects the brain of the child. The child would be taken to the clinic room where I had to give injection streptomycin, not injection on the buttocks or thigh, but inside the spinal column. And if we don't do that, the child will not recover. But still, with that, some of the children passed away. And these are the two infectious diseases which I found in the General Hospital Kuala Lumpur, a town. And this is during the colonial days in 1955. But when I went to work in Kedah, 8 years in hospital and 10 years in the rural areas, there were diphtheria. Of course, tuberculosis was still rampant then. The diphtheria came from children from the kampongs, and because it is so infectious, it gets spread from one kampong to another. We had 12 cases of diphtheria among children in Alostar, and that was because one child had disease. He went to the grandfather's house 12 kilometers away, spread the disease there, and 3 children died in the second kampong. And when this child went back to his original kampong, he died there. When we investigated, none of them had immunization against diphtheria. Now, we are very concerned about this because the child diseases which could kill them were 5 at that time: tuberculosis, diphtheria, whooping cough, tetanus, and polio. So Ministry of Health took charge of this, and in 1960s and 1970s we were very aggressive about immunization of the children 24 hours after they were born until they grew up to 1 year, 1.5 years, and get their boosters before they go to school and later. So during that time, our public health system was established, and we have to be very grateful to our Prime Minister Tun Abdul Razak, who introduced all the rural health program, giving priority to education and health, and to get rid of the 4 evil problems in the rural areas, which is poverty, illiteracy, ill health, and apathy. We have to do this within the 5-year program and to continue on after that. And fortunately, and we are very proud of this, we brought down the infant mortality rate. and also the maternal mortality rate, which is also our concern, from 75 per thousand live births in 1957 to 6 or 7 per thousand live births by 2004. We are extremely proud of that. And so far, we got rid of polio, we got rid of diphtheria, tuberculosis among the children. But what is our concern now is that we've heard reports that there are groups which are against vaccinating their children for some reason. And this worries me, and also not only me but my colleagues who are working in the hospitals and rural areas, because there seems to be an increase again of the mortality of children and of mothers because of these lobbyists who are anti-vaccine and also confusing the public, especially the mothers in the rural areas. So we are trying our best to reach out to the people, especially the rural people, and not only that, I think the professional mothers also, about this anti-vaccine campaign by certain groups, and to assure them that one, the vaccine is safe, and a lot of investigations and reports and trials have been done by specialists, and also for years and years this have been done, and they found that they are safe. And secondly, the religious groups are very concerned that and they confuse the public by saying that the vaccines are haram, which means it cannot be given to the Muslim population. But I have to assure you that Islam says that, first of all, Islam says that we can give immunization to our children, and secondly, fatwas has been given around to say that that Muslim population can have this immunization of vaccines, and thirdly, the Ministry of Health has also assured us that there's no component of porcine elements in the vaccine, which means that it is permissible to be used by even the Muslim community. And then there was this group which advocates alternative medicine, and they say that mothers, the children can be immune through the breastfeeding, from birth, and also good nutrition and good hygiene. Yes, this is important too, but it is not enough for the little child to have a good immune system when he grows up. So he's still vulnerable to such dangerous diseases which affects children. And secondly, also, there's also a group to say that they should let nature do its work, and they want the children to have the disease to get their own immune bodies. But and this is done through naturopathy and homeopathy and also traditional medicines. We have not yet obtained any evidence of their work which these people, homeopathy and naturopathy people, were doing. So it is best for parents, mothers especially, to be wary of such groups. As a mother of 7 children, grandmother of 18 and great-grandmother of 1 child. I am with all the mothers that are out there who have children to look after. I would advise that you do not confuse yourself with all the promotions that have been made by irresponsible groups. If you know that you love your children, they are our assets. So as a mother, the instinct is to look after them from the day they are born until they are grown up. So use your common sense and give yourself the chance to make your own decision and not to be guilty about giving your child a vaccine, because you are doing the right thing for your child, and that is to save them from the dangerous diseases which were rampant before. So I hope mothers and also parents at large would take heed of this advice which I'm giving, because I feel very sad when to hear that mortality rates of infants in Malaysia, especially in Kedah, is rising up. We have already been the most success country to bring down the mortality rates of infants and mothers who are pregnant and postnatal, but it seems the lobbyists are just going against our efforts, and that's why I feel very sad, not only myself, but also my colleagues out there, the doctors, the nurses, and the midwives who have worked so hard the past years to bring down the rates and to look after mothers and children. So I hope our campaign will be taken heed of by parents out there. Thank you.